Happy Wednesday, friends. I spent several years working directly in public health, particularly for the Centers for Disease Control and Prevention, or CDC. And during that time, I would get countless inquiries from pharmacy students and fellow pharmacists about how I managed to get into the public health field, what I did, just lots of people curious to know more about my background and my work. And so I had lots of conversations with pharmacists about how they could enter the public health space. Um, but the reality is that any pharmacist who wants to be or practice as a public health pharmacist can do that if they want. And specifically, they can do that through writing and communications. That is where my work has led me, and that is what I'm going to be talking to you about today. So if we have not met yet, I've just shared that I'm a public health pharmacist by background, but most of my experience has been in medical writing and health communications. I've been in that field for over a decade, have been a health content strategist for 7+ years, and I run the Health Professionals to Health Writers Accelerator program, which is a 6-month accelerator that teaches fellow pharmacists and other healthcare providers how to replace a portion of their income through freelance health content writing. And freelance health content writing is actually the skill set that can allow any pharmacist who wants to be to execute on their expertise and their skill set through public health. So that is what we're going to be talking about today. We're kind of some reasons as to why that is true, and how you can kind of think about your interest in public health and determine whether that aligns with roles that are related to health content writing and communications. So when I was working in public health, or actually, I think I was a student. I was a student who knew that she wanted to go into public health as a pharmacist, which was kind of a roundabout path. But I had a mentor who was also a public health pharmacist at the CDC, and he said to me that there was this disconnect in terms of how pharmacists were viewed in the public health field, which I knew, but to hear him say it in this very concise way was kind of enlightening. And so he said, pharmacists are commonly seen as professionals who are able to execute public health initiatives, right? If we think about vaccinations, if we think about patient education, if we think about different kinds of testing that are available at pharmacies, sure, pharmacists are commonly seen as very accessible healthcare providers who can execute on public health initiatives. But more rarely are pharmacists seen as active participants in the actual strategic development of public health programs and initiatives, right? So we can be like the people doing the thing, but it's much more rare for pharmacists to be or at that point in time, it's still rare, but at that point in time, it was much more rare for pharmacists to be active participants in the development of the things. And again, this remains true today, although things have improved somewhat. But what I have learned over my career as a writer and communication specialist is that there is another way for pharmacists to be actively engaged in public health. And again, that is through health content writing. So there are 3 ways that shows up, and I'm going to talk you through each of them. The first is through improvement of health literacy. Now, if we look in just the U.S. alone, this is not even a global perspective. This is just looking at the U.S. There are 90 million Americans who have low health literacy. 90 Americans have low health literacy, and we know that when people have low health literacy, it's not something that is limited to how they are able to receive and process information. This actually has a direct impact on individual patient health, community health, and healthcare costs. Low health literacy is tied to more hospital visits, longer hospital stays, incredibly large healthcare costs. Like, there are concrete consequences of low health literacy. And one of the interesting things about the latest Healthy People iterations, so that would have been Healthy People 2030, is that they expanded the ways that they talk about and address health literacy. There's personal health literacy, which is like the individual's ability to find health information, understand it, use it, not just health information, but health information and services to inform their own individual decisions and behaviors. That's like the individualistic view of health literacy. But they added a definition that addresses organizational health literacy. And that organizational health literacy really refers to an organization's ability to help people find and understand and use health information and health services. And the expansion of this definition was really important because it takes all of the onus off of the individual and recognizes that there is an organizational responsibility as well to help individuals and communities access information and services, right? That it's not just about what the individual can find, use, and understand, but it's also about how the organization is helping individuals and communities find, use, and understand that information. And so one of the ways that we as pharmacists and other healthcare providers are able to help organizations meet their health literacy responsibilities is through the generation of health content for those organizations. So when I am working with a company that designs, let's say, wearables for senior population, right? When I am creating content for them, I am helping them meet their organizational responsibility to meet their desired customers where they are, provide information and education that their desired customers can understand, can engage with, can use to inform their behaviors. The reason why health literacy and the ability of pharmacists to influence health literacy through health content writing is really important is because, as we said, that is not just about like cognitive awareness and knowledge. It's also tied to actual patient care and health outcomes. And so the fact that there is this organizational health literacy responsibility means that by helping organizations generate health content, we're also able to help advance health equity and reduce health disparities. So if we think about how that happens, when we're getting information, education, services, and awareness about those services to specific audiences, and we're doing that in ways that we know will resonate with the audience, in ways that we know the audience can understand, can appreciate, and see the value in their individual lives, in ways that they feel excited about, in ways that are inclusive, then people are able to act on that information, which helps advance health equity and reduce health disparities. The inclusiveness portion is really important because in communications, one of the core requirements for effective communication is knowing who your audience is and being able to identify not just their demographics, not just their psychographics or like their motivations, values, etc., but also their behaviors, because those behaviors are going to directly inform what types of messages the audience needs to see, hear, read, whatever, in order to shift behaviors. And we know that with a lot of health content, the goal is not just to inform, although sometimes it may be, but the goal may also be to shift behavior. Especially when we're talking about writing on behalf of clients who are often healthcare companies trying to address healthcare concerns in their own particular way. So when we're able to provide that content that is inclusive, that is respectful of people's identities, whether it's race, nationality, language, immigration status, that's respectful of their lived experiences, that's respectful of their lives and their circumstances, then we know that the audience is more likely to consume that information and more likely to act on that information because it's personalized and tailored to them. So that is one of the advantages or opportunities that we have as pharmacists and healthcare providers who are health content writers, is creating that content and that information that is highly tailored to different audiences so that we can shift and improve healthcare behaviors and again, help achieve health equity and reduce disparities. Lastly, and kind of most importantly for me personally, is the ability to counter and address health misinformation through health content writing. Um, there are, whether or not we as healthcare providers are the ones providing the health information, people are getting it from somewhere. It could be other sources on the internet. It could be friends and family. It could be random memes that go viral and actually have no basis in reality. Information comes from a lot of different sources. And as we know, especially after the pandemic, a lot of that information is either just generally false and misleading, or maybe outright and intentionally false and misleading. And I've said this before in different spaces. My professional mission is to fight health misinformation. So that informs all the work I do. Again, all of which is communications and content work. For other pharmacists and healthcare providers who are also interested in knowing how they can address misinformation and counter misinformation on a larger scale, because you're probably doing so in one-on-one direct patient interactions all the time. Patients will tell you what their family member said or what their, friend at work said, and blah blah blah, and then you have to address those myths and try to get them to um, to to take on a certain behavior. But doing that at scale for populations, for the public, is something that's achievable through health content writing. And so that's a huge part of the reason why I transitioned into this specific type of medical writing, as opposed to some of the other types that I had explored previously. And it's one of the things that keeps me most engaged in it. It's being able to directly counter and fight against the effects of health misinformation through the development of high quality, engaging, interesting, actionable health content. So even though I don't still work at the CDC, I still consider myself a public health pharmacist, because the communications and content work that I do has the direct effect of improving public health. And so, to my point, if you are a pharmacist or a healthcare provider who's been interested in becoming a public health professional, there are ways to do so physically or literally working for a public health agency or organization. So that's some food for thought for you. We have the ability and the opportunity to be more creative in how we define our roles and how we define the work that we do. And so I encourage you to think about sometimes think about the effect and the impact that you're looking to have, rather than the employer, right? That doesn't necessarily have to inform the outcome of the work that you do. For anyone who's interested in learning more about the health professionals to health providers accelerator, you can always comment waitlist if you're interested in future cohorts, and I'll share more information with you once you do. And I'll catch you all on the next Health Writing Week.